Hello, everyone. This is Dr. Richard Fleming, and today is Wednesday, the 30th of December, 2020. Just today and tomorrow, and we're done with this year and this decade. One of the things I always tell my students and people around me is that I'm willing to change my mind on something if information and evidence can be brought to my attention that causes me to rethink the premises that I have used to make a fundamental decision with, or for that matter, a non-fundamental decision. In the case of masks, I've been a firm believer that this cannot possibly interfere sufficiently with oxygenation of patients, given the fact that the oxygen and carbon dioxide molecules are smaller than viruses, and the viruses themselves are not being stopped by the mask unless they're attached to water droplets from coughing or sneezing. That being said, the patients that we've been looking at previously that were not in a critical state, typical individuals on the street or people who claim to have a breathing problem but don't appear to be labored, had shown no desaturation or drop in oxygen content while they were wearing masks. And I've seen other research data to support that. However, something that we have seen that is alarming are individuals who have acute, sudden breathing problems. These are frequently individuals that have underlying lung disease to begin with, something called chronic obstructive pulmonary disease or chronic obstructive lung disease by some people, or reactive airway disease, which is also referred to as asthma. In several of these individuals, what we've noticed is their oxygen saturation deteriorates when they're in periods of respiratory distress and wearing the masks. When the masks have been removed from their faces, their oxygen saturation improves. Well, I'm not certain exactly why this should occur. It is an observation which would suggest that we need to pay particular attention to individuals with acute or sudden respiratory distress who are wearing masks. It would appear, at least from the evidence that I've been looking at and the desaturations we're seeing, that the wearing of masks in these individuals could be problematic. The desaturations are going from the mid-90s, as they should be, down to the mid-80s, which is much better than if they went down into the 65 or 70 range. But still, mid-80s are where we make clinical decisions. Mid to upper 80s is where we make clinical decisions that supplemental oxygen is required. If we're masking these patients simply because we're concerned about SARS-CoV-2 and causing respiratory deterioration that may result in our having to intubate them, we may need to rethink the use of these masks in critically ill patients.